Which of the following stones is exclusively formed in gallbladder only? Which of the following stones is formed exclusively in gallbladder only? Very interesting question. It is formed only in black stones. Only black stones are formed exclusively in gallbladder. So cholesterol stones, brown stones can form in the bile duct also. This is a very important point because black stones occur in hemolytic states. They are found exclusively in the gallbladder. Whereas brown stones can occur within the biliary tree and suggest a disorder of biliary motility disorder associated with bacterial infection. So let us discuss about the gallstones now. Gallstones can be divided into the following types: cholesterol type of gallstones and pigment type of gallstones, and the other one is mixed stone. So please remember, 100% cholesterol is known as pure cholesterol stone. 100% they contain cholesterol. Pure cholesterol stone, it is formed of cholesterol monohydrate crystals. Cholesterol monohydrate crystals are forming this cholesterol stones. Okay, very simple point. Pigment stones are stones which contain less than 30% cholesterol. Please remember, they also contain cholesterol, but the content is less than 30%. Whereas mixed contains more than 30% cholesterol. So in India, the most common stone is mixed stone. In world level, the common stone is mixed stone. Actually, there is no point mentioning India. Therefore, you can remember the most common stone in Asians is brown pigment stone. In Western countries, the most common stone is cholesterol stone. Okay, this is the basic outline I am telling you now. Now, brown pigment stones are further divided into brown pigment stones and black pigment stones. So please remember, they both will have cholesterol, but the cholesterol content is less than 30%. So what are the components of brown pigment stone? It is made up of calcium palmitate, calcium stearate, and calcium bilirubinate plus less than 30% cholesterol. So calcium palmitate, stearate, and bilirubinate and less than 30% cholesterol is brown stone. Black stone is made up of insoluble bilirubin pigments. Insoluble bilirubin pigments made up of calcium phosphate is present in these. Insoluble bilirubin pigments plus calcium phosphate and calcium carbonate are all seen in black pigment stones. This is the reason black pigment stones are very, very hard and they are radio-opaque. In more than 50% time they are radio-opaque. Brown pigment stones are radiolucent stones. They are not seen on X-ray at all. They are radiolucent stones. 100% radiolucent stones. Whereas cholesterol stone itself is 15% radio-opaque. Cholesterol stone itself is 15% radio-opaque, and cholesterol stones are also hard golden yellow color stones. Cholesterol stones are hard golden yellow color stones. Whereas brown pigment stones are actually not stones. They are soft earthy stones. They are soft earthy stones. When you take in your hand and crush it, it will fall into pieces. They are soft earthy stones, brown stones. Black pigment stones are very hard radio-opaque stones, and they have an incidence of total incidence of black pigment stone is 10 to 15%, and they are more common in children, and they are more common in hemolytic anemias. So please remember, more common in hemolytic anemias, and therefore this is a stone exclusively formed only in gallbladder. They cannot form in the bile duct. They cannot form in the bile duct. Okay, they cannot form in the bile duct is a very important point. With related to brown pigment stones, there are so many MCQs I want to tell you. Brown pigment stones. So brown pigment stones are the most common stones in Asians. So the most common stone seen in infection. What infection? Like E. coli, like dead ascaris swarms, dead worms of ascaris, Clonarchis sinensis, known as Chinese liver fluke. They form stones in the liver known as hepatolithiasis. They are the stones formed in the presence of foreign body and stent. Any foreign body or stent in the bile duct can form a stone known as brown pigment stone. Brown pigment stones are the stones which are seen in infection, foreign body, stents, and these are the stones which are formed in the bile duct itself, known as primary bile duct stone. What is this primary bile duct stone? So I already told you, if there is a poor biliary motility or there is a bacterial infection in the bile, stone formed in the bile duct itself. Gallbladder will be normal. The stones are formed in the bile duct itself, known as primary bile duct stone. So these are primary bile duct stone, are not the common stones in the bile duct. The common stones in the bile duct are nothing but the stones formed in the gallbladder jumping into the bile duct are known as secondary bile duct stone. They are the most common stone. And usually they are mixed stone or cholesterol stone. So the one question which can come for your exam is, what is the most common primary bile duct stone? Means it is brown pigment stone. Okay. So a patient underwent cholecystectomy, went home, and coming after 2 years. After 2 years, a patient is coming back to you with a stone in the bile duct. What it can be? It can be only one stone, that is brown pigment stone, known as recurrent stone. It is known as recurrent stone. Coming after 2 years is known as recurrent stone, or secondary, is also known as primary bile duct stone. So primary bile duct stone or recurrent stone, all are brown stone. These are high yield MCQ points from brown pigment stones. Okay, please don't forget the points of brown pigment stones. Simultaneously, you should not forget the points of cholesterol stones. We already know very well, cholesterol stones are formed due to supersaturation of cholesterol or due to decrease of bile salts What are the places where there is decrease of bile salt? Number 1, cirrhotic liver cannot produce bile salts. Number 1. Number 2, small bowel syndrome or resection. So when the small bowel is resected or ileum is resected, there is no enterohepatic circulation, so the bile salt decreases. Short bowel syndrome, Crohn's disease. So these are the places where bile salts are low. Supersaturation of cholesterol happens in patients who are obese. Obesity, high fat diet, clofibrate therapy, patients who are on clofibrate drugs, patients who are on fasting, patients who are on TPN, clofibrate therapy, high fat diet, in all these cases, including stasis. Stasis is nothing but stasis is seen in TPN and fasting. So all these cases you can get supersaturation of cholesterol or decrease of bile salts results in formation of cholesterol gallstones, which are golden yellow color, and they are nucleation of monohydrate crystals, cholesterol monohydrate crystals. So let us see the questions now. So please remember, the cholesterol stones are formed by crystal formation is accelerated by pronucleating agents. Can you tell me examples of pronucleating agents? Means number 1, it is glycoprotein. Where did I discuss about glycoprotein? Can you tell me? Glycoprotein is secreted from the neck and cystic duct of gallbladder. That is mainly to prevent the gallbladder mucosal damage from the detergent activity. It will result in crystal formation. So glycoprotein is having good property as well as bad property of formation of cholesterol supersaturation and immunoglobulins. Bile stasis due to fasting, TPN, vagotomy, octreotide drugs, somatostatin analogs can also cause gallstone cholesterol type. Okay, please don't forget these points. Pure cholesterol stone is less than 10% only. Black stone is 10 to 15%.